Hi everyone. Today's case is a 16-year-old female who was brought to the clinic by her parents, stating that she gives a history of spitting out of small amount of blood 3 to 4 times in a day, and they are seeing it since last 3 to 4 days. But she denies any other symptoms of cough, breathlessness, chest pain, fever, or loss of weight or loss of appetite. And she does not have any significant past history of tuberculosis or any other respiratory illness. And when we asked about the other bleeding sites like epistaxis, hematuria, or blood in stool, she denies all of those other symptoms. And her parents have consulted multiple clinics, and she was treated symptomatically with the tranexamic acid, and during the course of the treatment there was no blood in the sputum, but as soon as the treatment stops, again there is a recurrence of this blood in the sputum or saliva. So they were little anxious about the patient, and when the patient came to us, she was completely comfortable. There was no respiratory distress and vitals were completely normal. And on examination finding, we did not find any pallor or icterus or clubbing, lymphadenopathy, or any cyanosis. And respiratory as well as cardiovascular examinations were also within completely normal limit. So we ordered few investigations, among which the complete blood cell count, the platelets were completely normal, and coagulation profile, PT, aPTT, INR were also normal. Chest X-ray was asked, and it was done multiple times before also, which was not having any significant pleural or a parenchymal abnormality. So the question was, what is the next best step for evaluation in this patient? So when you see the background history, the patient only gives spitting out of the blood, and there is no preceding cough, there is no other significant respiratory symptoms, past history. Blood has stopped when there is a conservative management or symptomatic treatment. So at this moment of time, instead of going to higher investigations, because all the investigations which have been done till now are completely normal, so better to go for a re-examination of oral cavity. Okay, so the upper respiratory tract should be examined carefully, because for hemoptysis we should need to identify the origin, whether it is originating from the lung or from the upper respiratory tract, because any hemoptysis which is originating from the upper respiratory tract, from the oral cavity, from the gums, or from the nose like epistaxis, that is called as a spurious hemoptysis or a pseudo-hemoptysis, and it is almost always associated with the saliva, and it will not be having the frothy sputum. So the similar case was there in our patient, where it was associated with the saliva, there was no cough, there was no frothy sputum. So we did a oral cavity examination, and there was a bleeding gum in the molar aspect, and that was the reason for causing this spurious hemoptysis. So whenever there is hemoptysis, unless and until you know the origin is from the lung, don't go for extensive evaluation like HRCT thorax or bronchoscopy, provided that your preliminary investigations like chest X-ray and blood investigations are within normal limit. So this was the case of spurious hemoptysis, and the bleeding gum was treated, and the patient did not have any further episodes similar to this. So this was the total 8 case series, and if you want to learn more about hemoptysis, there is a video on Mediversal Academy YouTube channel which is taken by me. So you can see the hemoptysis and how to manage and what are the different types of hemoptysis on that channel. Thank you very much.